I want to talk about inflammation, chronic inflammation, inflammaging, as they say. This is a theme, inflammation is a theme that I hear about across medical specialties. It's almost like the elephant in the room where everyone's like, yeah, inflammation's involved all the time. How does aging interact with sex to remodel the immune system in ways that impact cancer risk and treatment response?
Absolutely. So you're right. It's a very complicated topic because from one side, we know that chronic inflammation is bad in terms of outcomes. This has been demonstrated in multiple settings, including recent studies with CAR T cell therapy, where inflammation at baseline is associated with poor outcome and more toxicity. At the same time, our therapies do cause inflammation because we want inflammation to fight cancer. So I think a big difference is like, first of all, acute versus chronic inflammation. So acute inflammation after therapy is actually something that we want because it's something that stimulates the microenvironment, stimulates the immune system. Chronic inflammation is typically associated with poor responses because that leads to chronic activation of the immune system and progressive exhaustion. So one thing that I think is going to happen, and it's partly already happening, is having score, basically having inflammation score from the get-go, and potentially hypothesizing to sort of turn off the inflammation before therapies. Anti-inflammatory agents, antibodies against IL-6, or this type of approaches, cool down the inflammation before then infusing your therapy, and then having the good inflammation, right, the acute inflammation that you need to get rid of the tumor.
Hmm.
Of course, we are this is going to be in the far future, but it's good that at least now we're measuring it. We have a few biomarkers, I don't know, ferritin, CRP, and these type of things that we can use in our patient to get a sense of the inflammation state.
Mm. Can you explain how chronic low-grade inflammation might blunt or skew responses to immunotherapies in older patients? But first, can you just tell me what counts as chronic low-grade inflammation?
Yeah, I think you got me there because it's hard, right, to define what is chronic and what is acute, and what's the level. I would say that age is often, especially in patient with cancer, is always associated, or very often associated, with a chronic level of inflammation that is actually triggered by the presence of the cancer cell. Now, um, we talk about chronic when it's more than a few weeks, right? You can have a fever. Let's say the classic information is the response to infections. Typically, when you get the flu, you maybe have a fever for a few days, for a week, and then it goes away. So that is considered acute. When we're starting talking about 2, 3 weeks, months of inflammation, that's when we're starting talking about chronic inflammation.
Mm.
It's really hard to quantify, but going back to the example of the autoimmune disease, there are biomarkers. There is, for example, the erythrocyte sedimentation rate, which is a gross biomarker of inflammation. And so there are others that you can evaluate, but there are no sort of, um, let's say, agreed upon guidelines to tell you, oh, this is defined as inflammation threshold, this is chronic, it's sort of more a broader evaluation of the patient. And
Mm. When we look at this chronic inflammation, is it generally understood, do people who have things like chronic rhinitis, chronic sinusitis, allergies, things like that, do they count as having chronic inflammation?
no, I think those are sort of more infection-driven inflammation. They typically self-resolve. Even allergy has a completely different pathway that what would be the pathway against the tumor, right? So we're talking more, for example, in autoimmune disease, you know that you have a chronic activation of the T cells or of the B cell against potentially self-antigens, and so it's diffused. Like, for example, rhinitis, it would be localized to certain tissues. Here we're talking about diffuse inflammation, right? So it's typically the viral ones are self-resolving and they have a limited duration. Here we're talking about more patients that have a chronic stimulation due to either a cancer or autoimmune disease that has a systemic inflammation. So in every segment of your body there is inflammation.